All right, family. God bless you. What's the time you've been waiting for? That's right. Senior Talk with Claire Hubbard, your resource and information show for people getting better with age. Well, as I mentioned, joining us once again, and as no stranger, we have a new face to a great company and organization that has been with us almost since the inception of our show over 13 years ago. Previously known as Great Lakes Clinical Trial, now we have Flourish Research. They are a global dynamic of multiple sources that are beneficial to our community at large. So joining us today is a special guest, and he's now going to be our co-host for dates to come. And his name is Manish Jain.
Yep, you
All
got it
right,
right. Mini, yeah,
all
Manish,
right,
yeah, the Jane like plain Jane,
all
exactly.
right, fantastic. So everyone, stay tuned. Tell your friends, Senior Talk is live. We'll be right back after our commercial opening. All right, everyone. As mentioned, we are back here live, and I'm so excited to have with us is Flourish Research. Everyone knows the name Great Lakes Clinical Trial, where when you got expansion and you do collaborative efforts, this what happens. A great ambiance of partnership with Flourish Research and Great Lakes. So now joining me today is a new partner to me, new face, but we've been in a virtual green room. We've talked about it. We've had some great experiences. And I just want to welcome to Senior Talk. How are you this beautiful day?
I'm doing great, Claire. Thank you so much for having me. I'm really, really looking forward to for this time that we're going to spend together.
Absolutely. So, what we want to do, we've had our history of Great Lakes, and now we just reintroduced, I believe, last month, Flora's research to our viewing and listening audience. But if you would share with us your title, your responsibilities, and then we're going to dig more into our topic for today.
Yeah, great. So I'm a physician and I run a private practice in the north side of the city in the Ravenswood area. It's really one of my key passions is to see patients and improve the lives of my patients through directly taking care of them. I've been working as an investigator on clinical trials for the last 8 years or so, and partnered with Steve and partnered with Great Lakes. And over the last years, we have really expanded a lot of the different types of studies that we are doing. So we have a number of different areas that we look at. So some of it stuff that I know Steve, our founder of Great Lakes, has talked to you about a lot of stuff in the memory space.
Yes.
And so really, really important work. We've really expanded over these last few years into working a lot on vaccines. And so there's a variety of different vaccine studies that we do across our sites. The vaccine studies are starting to change a little bit. It used to be we just wanted to get healthy folks in. If you're 18 and over and you're healthy, let's come on in. Now we're really looking more at patients who already have some type of medical issue, right? That
Mm-hmm.
medical issue might be someone who's got emphysema or someone who's got heart disease. And so the vaccine study is evolving a little bit. We're trying to protect really our most vulnerable patients. Another big area that we're really expanding into is heart disease. And so
Yes.
this is near and dear to my heart. My multiple family members, I'm sure many people in this audience with multiple family members who've been afflicted with heart disease. My family is no exception. And so at our site here in Ravenswood, we're really focusing on trying to help those patients who've either had heart disease lead healthy, long lives, or if patients are at risk for heart disease, to help prevent them from getting that first stroke, first heart attack. I'm a big numbers guy, so I'll give you some numbers here. Heart disease, the number one killer in America. Strokes are the number five killer, and one of the leading cause of disability. Um, our patients of color, our African American patients, bear an unfair burden when it comes to risk. So we know that our African American patients 30% more likely to die of a
Mm.
heart attack or stroke. There's probably a lot of reasons for that, right? But what we're trying to do is really kind of help close this gap and help our patients, particular to clinical trials, and a lot of kind of different, interesting ways that we're trying to do that.
Wow. So let me ask you, in your experience, would you say that heart disease is hereditary, or is it a how does that work? Because a
Yeah.
lot of people think some disease are hereditary. You don't have to have heart disease because your loved one had it. So can you
Yeah.
give us some clarity on that, if you would?
Yeah, no, it's an awesome question and one that comes up a lot in clinical trials. So it's a mix, right? Definitely, the diet and your exercise and the things that you're kind of doing in your day-to-day life. It's certainly really, really important to help understand your risk and
Mhm.
help modify your risk for heart disease. It's only part of the story, though. Increasingly, we're learning more about genetics, stuff that you can't exercise your way out of, or you can't,
Yeah.
have a healthy diet out of. Like, one example, we're really focused at our Ravenswood site on something called LP little a. So it's LP and then in parentheses the little a. So LP little a, I think of it as almost like a supercharged, extra sticky version of bad cholesterol. So
Mhm.
typical bad cholesterol, LDL. We've heard of LDL, right? It's that bad cholesterol. It drives a lot of heart attack risk. LPA is like, again, a sticky, supercharged version of that bad cholesterol. And that's a number that we're starting to check a lot more in clinic and also check it in clinical trials. When we think of that LP little a in levels that are high in our patients, we know it's directly connected to heart attack, stroke, all the different cardiovascular events. And so historically, we were just checking it, right? We were just checking it, and patients would know, yeah, I've got a high number. We think about checking in patients who got early family history of heart disease, or patients
Right.
themselves, had other risk factors like diabetes or kidney disease. And so we've now kind of learned that there's a pretty strong connection between what your LPA level is and your risk over time. We also know that it affects different groups differently. So we
Mhm.
know our African American patients and South Asian, right? I'm South Asian. We tend to have higher levels of LPA, and we haven't yet had a way to target the actual sticky bad cholesterol. So
Sure.
take a traditional medicine like a statin, right? Great medicine, right? Really helps prevent heart disease. It doesn't drop the LP little a level.
Mm.
Again, diet, exercise, all these important things, really important, but they don't modify this risk that's imparted by the LPA. So one of the studies that we're doing is we are looking for patients who have some type of risk factor. That could be high blood pressure, could be kidney disease, could be diabetes, could be a mix of all those things, could be advanced age, right? We know these are all risk factors for heart disease. And we want our patients to know your number. Like, well, what is your LPA number? LPA, you could get it checked with your doctor. It's covered by many insurances,
Okay.
um, and so it's a great thing to kind of think about getting checked. We do offer the opportunity to get it checked here at Ravenswood through a clinical trial. And so again, we're looking for folks who've got some heightened risk based on age or high blood pressure, or, diabetes, just to name a few, and then helping those patients understand what their number is. And so, I'm busy here in clinic today. We had a handful of patients who themselves, like, right, they want to know their number. And so they're getting their level checked through
Yes.
the clinical trial.
That's beautiful.
Yep.
That's
If the
beautiful.
number's high, then we've got some agents that we think may help modify the risk by targeting that LPA. So that's just one example, kind of how genetics really are playing a role in also when we see certain patient populations at higher risk. We know
Mhm.
African American folks higher risk, South Asians higher risk for heart disease. Well, why is that? Where I think we're starting to learn a little bit, to try to find some of those factors of the why and how we're going to fix it over time.
You know what's critical, and I'm so glad you're being very thorough in your answers because it's amazing more recently to find out that one particular area like heart disease can relate onto diabetes,
Yeah.
can relate onto stroke. And some people were just realizing that. So I was wondering, how do we take a better approach to clinical trials? But let's do this. We got a little commercial that can help our viewing and listening audience. Everyone, stay tuned. So that commercial, there's going to be some listening audience. So just so you'll know, this was just a small snippet of sharing with you how to participate and do you qualify, just giving you the avenues of that. So let me tell you, Dr. Jain, let me tell you, what can you say is a good way to approach the most vulnerable population about participating?
Yeah. Great question. So first of all, going to where our patients are, I think that's super, super important. And what we really do here through Flourish is we network a lot with both patients, but also doctors within the
Mm-hmm.
community. We have a special relationship, just as an example, with the Association of Black Cardiologists.
Yes.
You can go to blackdoctor.org, and find a doctor who looks like you, right? Which is
Mm-hmm.
really important. Study after study shows that when the doctor or nurse practitioner, the clinician and the patient look like each other, the care is better. There's no doubt about that. So I think that that's one avenue of research. We got to bring the studies to where our patients are, and then also importantly, work with doctors, nurse practitioners, physician assistants who care
Yes.
for the patients that need the help. I think another thing is just being really honest and open about how clinical trials work. I think there's sometimes a stigma a little bit. I know, Clara, you're working hard to kind of help educate around that,
Yes.
and I don't blame our patients, right? There's a reason this stigma exists, right?
Mm-hmm.
Tuskegee Airmen, the syphilis. I mean, we've had I think a challenging history, but because of the kind of the historical bad things that have happened working with special patient groups or underrepresented patient groups, we now have a lot of protection and intention really built in. So when a patient signs up for a clinical trial, they're really signing up for a very open, honest, transparent experience. We're walking that patient, through a consent form, and that consent form, along with the person who's kind of walking them through it, helps the patient understand, what are the potential benefits, what are the potential risks. Every medicine that you or I, have taken or will take is based on a clinical trial. That's how we get
Mm-hmm.
medications approved. And to a lot of my patients, especially in my practice, they really like having the access to stuff, cutting edge treatment. And
Mm-hmm.
so I think bringing the studies to the patients, being super transparent and open with patients, walking them through that consent. And then I think the other big piece about being part of a clinical trial is the monitoring that you get.
Yes.
So I'll tell you something really cool. So joining a clinical trial for heart disease has been shown to improve mortality in the placebo group. So let me say that one more time. The placebo, the folks that aren't getting,
Mm-hmm.
a treatment potentially. If you sign up for a long-term outcomes trial, the studies have shown that even the folks not getting the real medicine are benefiting from it.
Wow.
Why is that, right? It's
Mm-hmm.
because they're getting extra monitoring from another team. So I've got a wonderful physician assistant who works with me, and he was talking to a patient. Patient's got a great cardiologist, great care team, but the patient over the phone just sounded short of breath. It just didn't sound right over the phone.
Mm-hmm.
So my really smart PA on the research side had that patient go to the ER, and that patient was having a flare of congestive heart failure. Now, that patient would have called their doctor at some point, right? But
Mm.
they called us first. We were talking to them first, and we were able to kind of help enact some change in that patient's care. So you get a
Wow.
lot of monitoring through.
Yeah, cheerleading for that. Wow, that's awesome. And
Yeah,
you do have to have um, a heart of empathy
yeah,
when you're working with clients on a diverse group of backgrounds, and
yeah,
some people's level of sharing family history may be intentional, or some people are just afraid to share it, or it couldn't happen to me. What I'd encourage seniors and those who listen and viewing is that, one, as I was watching something over the weekend, if you don't do it for yourself, do it for your grandchildren.
yep, yep,
Do it for those who are to follow you,
yeah,
and have something that concrete to say, yes, my loved one sought after the proper care for me in regards to clinical trials, because there is a benefit. And oh my goodness, the years have gone on. We've had much more better quality of care, as you mentioned, service, empathy on behalf of your personal assistant, or who was listening to that person.
yep,
Oh my goodness. I can only say what their loved ones are probably thinking. We weren't there, but you were there to tell them, hey,
yeah,
go to the ER and maybe have saved their lives. That's
yeah,
awesome. And so
yeah.
that's a big to do. So what we're going to do is we're going to play a quick commercial of one of your community partners. And I found this video from the Black Cardiologist, and this is with Flourish Research. Everyone, stay tuned.
The Association of Black Cardiologists is a group that was formed by 18 visionaries almost 50 years ago to eliminate the disparity that exists in cardiovascular care. The mission of the ABC is to promote the prevention and treatment of cardiovascular disease, including strokes, in Blacks and other minority groups, and to achieve health equity for all by the elimination of disparities. The association comprises of cardiologists, cardiovascular surgeons, vascular doctors, and community health workers, or anyone that is really passionate about this mission of eliminating the disparity that exists in cardiovascular disease. With that in mind, you do not have to be African American or Black to be a member of the Association of Black Cardiologists.
Wow,
I think,
great information. And that's
yeah,
something that's interesting. You would think you would have to be of a certain dynamic or
yeah,
demographic for that, but she said you don't have to be,
yeah,
because it affects everyone. That's the challenge.
yeah.
That's the real story. It affects everyone. So, and I will say, heart disease does not discriminate.
Nope, not at
You
all.
know,
And really targets, and beyond not discriminating, really targets. You know, some of us have certain ethnic background. So
I've had more recently family members who were male
yeah,
under 60.
yeah,
And so one of the things that I want us to do, and definitely my partnership with Floyd's Research, we already global. We're going to get there, because I want to do something. There's a term called National Hypertension Day on May 17th.
yep,
I think we need to check our numbers once a month.
yeah,
Life has a whole dynamic that you cannot predict. Once a month, we used to have something called check your numbers or know your numbers. And I
yeah,
think it would be helpful if we learned how to. And then, doctor, maybe you could come on and help us understand what we're reading on our blood pressure cuff.
yeah.
There's
Absolutely. I think
a
that's
lot of,
great. I think these little things end up making massive, massive differences.
mhm.
And again, it could be clinical practice, could be a clinical trial, but until right, until you know your number, you don't really know what you're dealing with. So,
Right.
and it's tough, right? It's easier to kind of have your head buried in the sand a little bit, but
Mhm.
really, once you kind of get this knowledge and empower things for your health, again, not just for you, right, Claire? You were saying for your
Right.
grandkids, right? So it's to help everyone.
Absolutely. So let's talk about the other offerings at your location, because I am just overwhelmed. We'll be doing this all year.
Yeah.
It's something for everybody. So let's talk about this program here.
Yeah, definitely. So, talked a little bit about the LP little a. We've got another cholesterol study where we're just looking for folks who've had a heart event. Could be a heart attack, could be a stroke, and their bad cholesterol, their LDL, it's come down, but it's not good enough with that
Mm-hmm.
conventional medication, right? Statins, conventional meds, great meds, really important. They don't work as well as we'd like to for every one of our patients. And so we're looking at an oral agent to help supplement the statin and really bring down the cholesterol. And we're going to follow patients over years to see how does bringing down their cholesterol, what benefits does it have, to that patient over time. We've got a lot of stuff in obesity. And so, you can't turn on the TV anymore without seeing a commercial for, Ozempic or, Zepbound or Manjaro. So
Right.
really, really incredible meds that have come to us through clinical trials. And so now what we're really focusing on is the next generation of these medicines. How can we get even more effective medicines with even less side effects? And so we're looking at a couple, kind of different special patient groups. One is folks with kidney disease. So if you've got kidney disease, we want to show that by helping that kidney disease patient lose weight with an obesity medicine, we're going to help preserve their kidney function over time, which is wild, right? It's a wild concept to think,
Mm-hmm. Right.
can
Right.
we, can we prevent dialysis by helping people lose weight, right? That's a really,
Oh,
really cool,
I'm
cool,
cheerleading for it.
cool idea. Yeah.
I'm just being so serious. I'm cheerleading for that opportunity.
Yeah, no, definitely.
Oh
And
my
we
gosh.
know a lot of our African American patients, right, carry a disproportionate burden of kidney disease for a variety of reasons. We're also looking for helping folks who've had heart disease lose weight. So if you've had a heart attack or a stroke, going on a medicine, kind of in that Ozempic type family, but like a newer next generation version of that, can we help prevent heart attack, stroke, hospitalizations, mortality, right? Can we help
Mm-hmm.
prevent that over time? So
Right.
that's another kind of important weight loss study that we're doing. We're doing another study in diabetics. So folks who are really having a tough time with their diabetes, their A1C, those blood sugar levels over the last
Yeah.
few months, just can't get them under control with that kind of conventional medicine. Can we jump in there with Ozempic type medicines, and how does that kind of work for patients? Um, we're really looking at trying to improve on what we had, right? So we're looking at studies, looking at Zepbound. Zepbound's a really, really popular common medicine. Can we add something more to Zepbound that allows us to bring the Zepbound dose down and decrease some of the side effects? So just a handful of some of the different stuff, but big picture, helping lose weight across different disease states. How does
Yes.
that help? How does that work over time? So that's another big
Absolutely.
focus of what we're doing.
So let me ask you this: Who the person to participate in a trial?
Yeah. So first and foremost, if you're interested, um, some of these studies, it takes some to kind of understand your medical history. We've got a great medical team that can kind of help figure out how to get your medical records. So then we can kind of look through that. But I'd say first and foremost, we'll take that time to talk to one of our medical team, and then we can kind of better figure out, well, what study opportunities might we have for you?
Great. So in this career, you have to have some testimonies of persons who've participated. Can you share a few of those with us?
Yeah, a lot. I mean, I had one patient. So I've enrolled a number of my practice patients with different types of arthritis into obesity studies. And so just looking a little bit at the testimonies that I've had from my patients, what are their lives with arthritis, um, you know 50 pounds overweight, and what are their lives once we've helped them lose those 50 pounds. Those are testimonies I hear day in and day out. I'll give another patient that I had, patient in my practice. Cholesterol was too high. He's already had a bypass surgery, and there's a medicine out there that could help lower his cholesterol. It's hard to get it covered by Medicare.
Mm-hmm.
So now he's in a clinical trial where he's getting a similar type of medication through a clinical trial. So these are just the things that we hear day in and day out, and this is kind of the fuel that that feeds my fire of bringing studies, really, really cool, important studies, to the patients that I take care of and the patients in the community.
So that participating, there was no cost for him. Is that correct?
Yeah, exactly. So
Wow.
no cost,
Wow.
potential access to a treatment, and also just like a whole nother care team to monitor, right? And so I think, I think those are all the features that make these studies so attractive to our patients.
Wow. So as you mentioned, so right now our focus is those on this first page here that I showed in our broadcast, the obesity study, as well as those with type 2 diabetes, or with or without, the chronic kidney disease, and heart disease. And so you're going to call the number or visit the website, flourishresearch.com. We are currently talking to you, and you represent the Ravenswood location.
Yep.
And that number is 312-931-8883. But what are your closing comments? I just know this is a year long and we have much more coverage to get to. And thank you so much. You were fantastic today. You're very fantastic. So we appreciate you giving your time and energy today. What is your closing remarks to our listening and viewing audience at this time?
Yeah, to me, it's like a joy to take care of patients and bring studies to my patients who need them. I think, Clara, what you're doing here in terms of helping inform and helping educate around this it's really, really important. And so I want to thank you for letting me be a part of this.
Yes.
This is cool. Very, very cool stuff. So I really appreciate it.
Absolutely. So as we mentioned, your guest today is flourishresearch.com, FLOURISH research, like flower-ish research.com. The number is 312-931-8883. And they are a sponsor of Senior Talk with Clara Hubbard. Thank you all for making us a part of your day. For more information, visit clarahubbard.org. And we just want you to know that in complete darkness, we are all the same. It is only our knowledge and wisdom that separate us. Don't let your eyes deceive you. We will see you next time for Senior Talk with Clara Hubbard. Everyone, take care.
Take care. Thank you.